Welcome to the Medical Association of Georgia's award-winning Top Doc Show. With more than 8,000 members who care for patients in every specialty and practice setting, MAG is the leading voice for physicians in Georgia. Go to mag.org to join MAG if you're a physician in Georgia. And thanks to MAG Insurance Agency for its support as a sponsor.
Good afternoon, and welcome to the Medical Association of Georgia's award-winning Top Doc Show. With more than 8,000 members who care for patients in every specialty and practice setting, MAG is the leading voice for physicians in Georgia. Go to mag.org to join MAG if you're a physician in Georgia. I'm Jeremy Bonfini, the Executive Director and CEO of the Medical Association of Georgia, and I'll be your host today to kick off a very interesting discussion with Dr. Wanda Barfield, who's director of the CDC's Division of Reproductive Health. Dr. Barfield, thank you so much for joining us today.
Oh, thank you so much, Jeremy, for the opportunity to join with you today.
Well, the topic of maternal health has been one that's gained much attention recently, both here in Georgia and nationwide. It's one that's of particular interest to our president of the Medical Association of Georgia. I wanted to see if we could begin talking about the maternal health crisis here nationally and across the country. Dr. Barfield, tell me about the disparities that you are seeing and that's driving the maternal health crisis. What is the driver? What are the drivers? Are there racial, ethnic disparities in maternal mortality that you see?
Yes, thank you, Jeremy. Just to give the audience a little bit of context, I'm a neonatologist and still practice clinical medicine in addition to being the director of the Division of Reproductive Health at CDC. So I've had a chance to have a first-hand view of some of the issues that are going on in terms of maternal and infant health. But what we know nationally is that Black maternal mortality rates in the U.S. are about 3 to 4 times that higher than those of white women. And last year, in a report that CDC published, we found that about 30% of Black, Hispanic, and multicultural women reported mistreatment during maternity care. And we know that bias and discrimination in maternity care is impacting their care and health. And there have been reports of discrimination that are higher among Black, multicultural, and Hispanic women. And also maternal mortality review committees identified discrimination and racism as a circumstance in about 30% of pregnancy-related deaths. And those are deaths that occur up to a year after delivery. So these differences in respectful maternity care are rooted in discrimination as well as bias and stigma that includes factors such as race.
Great.
So I'd also like to talk a little bit about Georgia, since that's where we are. And we know that a major driver in pregnancy-related deaths in Georgia are related to chronic conditions, including those in the postpartum period. And I think that's important for the audience, given the variety and breadth of those that are here listening today. And we know that in Georgia, a leading cause of pregnancy-related deaths from 2019 to 2021 were cardiovascular conditions that include conditions such as cardiomyopathy, also COVID-19, and hemorrhage. And we also know that about 85% of these pregnancy-related deaths in Georgia were preventable. And about half of these deaths occur later, between a week after delivery up into a year after delivery. So these are events that are occurring potentially outside of the hospital setting. And there's more information on the Georgia website about maternal mortality. So I would suggest your audience just take a look at that data.
Great. Well, thank you for that. It's always very shocking and striking, the challenge that we're up against. From a systems level perspective, what can we be doing to improve maternal and therefore infant health?
So there are quite a few things that we can think about in terms of systems. We know that just thinking about some of the current systems, even here in Georgia, we know that there are areas where we're not seeing the health systems that are needed in terms of maternity deserts. And we really also have to think about systems of care that are appropriate given a level. For example, if you would close your eyes and think about, where would I need to go, for example, if I had a stroke or a heart attack, or if I were in a major accident? We know that there are places that are designed for specific care at the right time and with the right team. We should also be thinking about that in terms of maternity care. And so we need to think about systems of risk-appropriate care that care for both very healthy birth and deliveries, as well as those that are more complex. And thinking about these systems are really very important. I think another factor that we need to take into consideration are what are driving the disparities in maternal health. And really, there are several. So one is, social determinants of health and issues related to social disadvantage. Also, structural racism and implicit bias in health. The variation of quality within hospitals, and those underlying chronic conditions like hypertension or cardiovascular disease, and those are more prevalent in Black women.
Right. Well, it's going to take a large and extended team to care for all the patients, both here in Georgia and nationwide. Can you talk about that team-based approach and how the variety of different care team members can come together to work with their physician to lead that team?
Yeah, it's very important that we think about a team-based approach and understand that there are many people who have a role to play in terms of improving maternal and as well as infant health. And it's both clinical and non-clinical members of that team. And I think thinking about how systems can create an environment of respect and patient-centered care is really important. So how can we think about hiring and keeping a diverse workforce and providing trainings for all healthcare staff on unconscious bias and respectful care? And that includes those that meet patients and families at the front door to those who are in the operating room. And how can we also promote a quality that focuses on that respectful as well as responsive maternity care equally? And how can we also think about the ways that communities can also participate in the awareness of respectful care, not just within the four walls of our hospitals, but within the communities? And how can we engage and interact with them? One way actually is becoming involved in perinatal quality collaboratives. And these are networks of clinical teams with both clinicians, public health leaders, other partners, community leaders, as well as patients and families that really come together to improve pregnancy outcomes. And for example, in Georgia, as we know, Black people are disproportionately affected by pregnancy-related mortality. And there have been community engagement strategies, including working with the Center for Black Women's Wellness to host bi-directional conversations related to the leading causes of pregnancy-related deaths for Black populations.
Great. Well, thank you for that. And I want to thank you, Dr. Barfield, and your team for the Hear Her campaign. The Hear Her campaign has really helped us hit the ground running and communicating with patients in a way that they can very much relate to. It's been a few years since the Hear Her campaign has been launched, and a big piece of that campaign is just encouraging communication between pregnant and postpartum patients and their healthcare team. Can you tell me a little bit about that focus of Hear Her?
Yeah, the great thing about the Hear Her campaign, and it's just about 5 years old, which is hard to believe, but it's important to note that we started the Hear Her campaign with women in Georgia, and it was really a great opportunity to raise awareness about the warning signs of potentially life-threatening conditions within a year after pregnancy or after delivery. And it's really a great opportunity to also include a variety of people who can be involved in improving health for pregnant and postpartum women. And what's great about it is the focus is about listening, about really listening as a provider, as a loved one, hearing about those concerns and taking action in terms of helping mothers to get the care that they need. So we're really excited about its growth. It not only includes those who are in Georgia, and there's an opportunity for not only the state, but then communities to really tailor some of these messages so that it can really connect with folks who need to know more information. And we're working with American Indian, Alaska Native communities. We're working in many different languages. Definitely check it out, cdc.gov Hear Her.
I can say, at least from my perspective, it was very educational to understand how certain conditions and symptoms may appear to patients that one would immediately point back to a maternal health issue. So extremely educational. You and your team and the CDC should be commended for your investment in Hear Her. As we think about working with patients, can you share any examples from your practice as a neonatologist of how we provide respectful, culturally appropriate, and patient-centered care?
Yeah, thank you, Jeremy. I think that, the issue of listening and thinking about unconscious bias is really important. We all have unconscious bias. We work in sometimes very busy, rushed scenarios. I think it's also important as we're in this age of technology to try our best to take the time to actually listen to people's stories, because there's a lot of information that I think we even miss in an electronic medical record or even one that's a lack thereof. I can tell you, anecdotally, in my experience, there have been many, many experiences where there was an assumption made that because someone's chart didn't show prenatal care, that they actually didn't have prenatal care when they did. Either that information was lost or in a different location where it wasn't found. And sometimes we can just simply ask. There's also a lot of information that sometimes comes in the context of people's lives that help us to better understand what their challenges are in terms of healthcare access, their ability to seek a provider, as well as those physical concerns and complaints that really may be warning signs. And I'm hoping that, members of your organizations, particularly those who aren't obstetricians, can understand and think about in the history asking women, well, have you been pregnant within the last year? Because that may impact what you may do in terms of understanding some of the chief complaints.
It's a great segue into a call to action for our membership. And it is not just the MAG membership here in Georgia. Top Docs has a nationwide audience. Is there anything else that you'd like to share with our physicians and their key care teams on how we can work together to improve maternal health for all patients?
Yeah, I think that there's lots of opportunities within our practices to really make that connection so that we're really, embracing the broader theme of listening to patients. And particularly for pregnant and postpartum people, there's ample opportunity for us all to play a role within our hospitals. Because remember, we not only may have patients who are pregnant or postpartum, we have many colleagues who are pregnant or postpartum. There are those around us in our communities, and there really is this opportunity to make improvements simply by working together in terms of listening and understanding concerns and thinking creatively and thoughtfully about how we can reduce disparities in these health outcomes.
Great. Well, thank you so much, Dr. Barfield. It's been an honor to spend this time with you to recognize the great work that you've done at the CDC with the Hear Her campaign. So thank you again. Thank you so much for your contributions, not just here, but for the health of women across Georgia and the nation. And I want to thank our audience. Thank you for watching this episode of Top Docs. Please share this program with your colleagues and family and friends. And remember to follow MAG on Facebook and Twitter. And don't forget that you can get past episodes of the show at mag.org/topdocs. From everyone at MAG, we look forward to catching up with you on our next episode. And thank you again, Dr. Barfield, for your time today.
Thank you so much. Thanks, everyone.
Thank you.
Thanks for watching this episode of Top Docs. Please share this program with your colleagues and family and friends. Remember to follow MAG on Facebook and Twitter. And don't forget that you can get past episodes of the show at mag.org/topdocs. From everybody at MAG, we look forward to catching up with you on our next episode of Top Docs.